So it's my pleasure to introduce Carlos Reina to moderate this session. Carlos is the Director of Partnership and Growth at Reach Digital Health. He has over 15 years of exceptional experience in forging high-value partnerships across diverse industries. With a decade of focused expertise in digital technology for health, Carlos has a proven track record of developing systems that support both users and health workers throughout Africa. He's also a polyglot with linguistic proficiency in Spanish, English, French, and Portuguese, and is committed to digital health mission to improving healthcare outcomes through innovative digital solutions. So please join me in giving a huge welcome to Carlos Reina to moderate this next panel session. Thank you.
Thank you so much for that. Thank you so much, everyone, and welcome to all of you joining us from different parts of the continent. It's a pleasure to be here. So good afternoon, good evening to all of you. This panel is quite exciting to me personally, and I hope you will find it as well. And we will be talking around innovations in Africa, around digital healthcare delivery, as well as health tech, telemedicine, and remote care. It's a privilege to be able to moderate this session. And yeah, I look forward to an engaging session. And I'll just set a little bit on the context on why this is important. And then I will go ahead and introduce our different panelists that are with us today. As we all know, Africa really stands as a pivotal in a pivotal moment in terms of healthcare innovation. A lot of the innovations that we're seeing even adopted in the so-called global north are really starting and giving and being born out of the continent. And so, you know, from the vibrant urban centers to the most remote rural areas, these digital solutions are bridging gaps, are ensuring that healthcare is not just a privilege for a few, but a right to access to all of us. And so today we'll delve into some of these exciting innovations that are really driving this change across different countries and different regions. And so from health technologies, to health telemedicine, to remote care solutions that are reaching populations like never before. Each of the panelists will bring a unique insight into how we can harness this technology to solve pressing healthcare challenges, empowering health workers, as well as enhancing patient outcomes throughout the continent. Over the next hour or so, I know we're a little bit delayed, but we'll try to keep it in time. We'll explore, you know, these different journeys. We'll hear from our expert panelists, and we learn from their expertise as well. We'll also have the chance to discuss the opportunities and potential challenges that they've seen, but we also would like to hear from you, the audience, in terms of what you've seen and questions that you may have. So as a starting point, I would like to introduce our distinct panelists, and each of them an incredible leader in the industry and really at the forefront of this revolution that I mentioned earlier. We start with Michael Joshua. He is the co-founder of Mikul Health, and this is a cutting-edge platform really revolutionizing patient care through accessible and innovative health technology solutions. He has a strong commitment to improving health outcomes. Michael leads efforts to bridge the gaps in healthcare delivery and empower communities globally. Welcome, Michael, and thanks for joining us.
Thank you, Carlos.
Thank you, Michael. I think we are missing Dr. Chibuzo. Maybe we'll have his present shortly, but then I'll go to Dr. Sisei, who is the CEO of KMS ETH Health and the founder and CEO of Tenawo Digital Health, really spearheading the innovative solutions to enhance healthcare delivery in Ethiopia with a passion for leveraging technology to improve patient outcomes. Dr. Abebe is at the forefront of transforming health systems in Africa, and we are very pleased to have him as part of this panel. Welcome, Doctor.
How are you, everyone? And thank you for having me. Thank you.
We move on now to Rafael Matuva, who is the Chief Executive at Medi Delivery Botswana, as well as Nexus Technology, leading really the efforts to revolutionize healthcare, logistics, and technology in the country of Botswana. Through his innovative vision, he's enhancing access to medical supplies and driving digital transformation in the healthcare sector as well. Welcome, Rafael. Happy to have you. Oops, I think he just dropped, and he's back. Welcome, Rafael. Thank you. Last but not least, of course, we have Yaya Mbuza, who is the co-founder and CEO of Sensei, a forward-thinking enterprise dedicated to harnessing technology to improve financial and social inclusion across Africa. With a focus on innovation and impact, Yaya is really driving the transformative solutions that empower communities and foster sustainable development. And just in time, Dr. Chibuzo has just joined us. Thank you, Dr. Chibuzo, for joining us. I'll just quickly introduce him. Dr. Chibuzo is the CEO of Drugstock eHop, a leading healthcare platform driving access to high quality and affordable pharmaceuticals across Africa. Under his leadership, Drugstock is transforming supply chain efficiency and ensuring life-saving medications reach underserved communities across the continent. Thank you so much, Dr. Chibuzo, for joining us. Hope you can hear as well. All right, we'll jump right into it.
Be here.
Thank you, Doc. We'll jump right into it, and I have a couple of questions for each of our panelists, and that will spark the discussion. We'll then obviously allow each panelist to have a time to respond. I'll be taking some notes and perhaps maybe some follow-up questions, but we also want to hear from the audience in terms of potential questions they may have. And actually, Dr. Chibuzo, I would like to start with you. Can you explain or share with us a little bit more how can regulatory frameworks in the African healthcare adapt to keep pace with the rapid digital health innovations while ensuring that patient safety and data security is being kept? Can you share some of your thoughts around that, Doc, please?
Thank you very much. Thank you very much, Carlos. I think the question is very pertinent to our space at this time as we come to terms with the rapidly advancing AI innovations all over the world, and expanding healthcare access. I think key to note, I'll just be very quick about it, is interoperability. Interoperability is key to ensuring that we're all accessing and using the same frameworks so that we can grow at the same speed and move collectively towards our desired goals. I think data security can be overemphasized. It is important that the right people have access to the right data, no more, no less. I think it's important to establish clear guidelines. Leadership from government is very key to this aspect in terms of establishing the vision and the guideline within the rules of the game that we can expect players to adhere to. But most importantly, and not the least of all, is trust and partnership between the public and private sector as we navigate this rapidly expanding and changing space. It is key to all we do that as we create the framework and the map for what the next decade would look like in this space, that we all come together and collectively chart the course that leads to quality healthcare for our patients.
Great, Dr. Chibuzo. I think that's a great answer, and I hear you. I think with the hype and the adoption of tools such as AI-powered tools, it is important that we have those guardrails and frameworks that can allow us to innovate, but at the same time protect. I also heard you say guidelines and the right people having the right access to the right information. So very much on point. Thank you for that contribution, Doc. We move now to Dr. Sisay, to you, kind of in the same vein and in the same sort of line. What do you think are the primary compliance challenges faced by healthcare innovators such as yourself and the rest of the panel in Africa in general? You can be specific perhaps on your own country experience. And how are these impacting, the scalability and adoption of new technologies? Do you see them as a fostering type of force or something that is actually hindering the ability to scale?
I think thank you very much for raising such a great question. And, as an African health innovator and working for the last 5 years in innovating the healthcare system, there are different challenges as a health innovator related to human resource challenges and also infrastructure and investment challenges for health innovators across the continent. Even if the number of smartphones and even the number of health professionals is increasing in different countries, but the attention that whether the private sector or the public sector giving for health innovation is a hassle, and even that is a challenge to health innovators to launch tailored solution, innovative solution, even to scale them. So most of the time as a continent, there are three challenges as a challenge. One is the investment challenge, the second is infrastructure and digital literacy challenges. So most of the health professionals encounter such challenges and that face for all health professionals in different countries. There are other accessory challenges, but the main challenge is this one. When you go to specialists, there are different opportunities currently in related to the penetration of smartphones, the expansion of infrastructure, and also even if such a situation is good for health professionals to innovate different local challenges, there are also investment challenges that the continent faces currently. So that's why we as health professionals give emphasis by prioritizing such local problems and give solution for prioritizing local problems rather than importing foreign solutions currently. Yeah.
Very insightful, Doctor. And I hear your sentiment. I think local innovators play a specific role in actually getting closer to solving these issues because they're closer to the problem, right? So they understand it better and they have the tools to actually do it. So how can we get the private sector and funding agency, philanthropic to actually believe in the solution and help them scale, not only leave them at a pilot stage or testing space? Thank you so much for that. That's quite insightful. We now move to, I don't see Michael anymore. I think he has dropped. I know he was coming in and out. So I'll skip him for the moment, but then we'll go. Was that him? No.
Hi, Carlos.
We then go with you, Yaya, while we wait for Michael. But there he is. Michael, can you hear us?
Hi, Carlos. Yes, I can hear you.
Perfect. Just in time. For you now on Michael. Can you maybe share a little bit how can healthcare companies and startups, innovators, can proactively address some of these compliance issues that we've been talking about without really stifling innovation, so without slowing the innovation that you guys are pushing forward, especially when developing solutions for these underserved populations, which you understand quite well, being very close to the issues and to the problems. Can you share your thoughts around that, Michael, please?
All right, thank you very much, Carlos. Well, first of all, I mean there are plenty of ways to go about it, but I think the very important things innovators, founders should do is in the area of engagement, right? So oftentimes, especially I mean with my background in software engineering and having spent over 7 years as a nurse in Nigeria, right? I tend to see a common issue, right? Especially with the techies, innovators, as it were, and that is the emphasis on the product. Oftentimes, so you see folks just go about conceptualizing ideas and solution without necessarily touching base with real users and the regulation behind it, right? So I would say in respect to regulation there should be an engagement. So whilst you are conceptualizing the idea, right, there should be a live engagement. And when I mean live engagement, so from the grassroots, those founders should touch base with the regulatory system to know what and what to add right from the beginning without having to wait till the product is finished. Now you would have to more or less break down everything, and it's gonna cost, and all of that. So I would say engagement is key, participation, right? Especially seeing that there is sort of some, it's a bit volatile, the tech ecosystem in respect to health, in that there's not necessarily a defined regulation or policy with respect to health that much yet, because I mean it's a growing ecosystem, it's a growing industry, right? I mean, even patients, users are yet to trust the system. So with this, there's a high importance for founders to really engage as soon as possible, because I would say it might favor us, the early adopters, to some extent help in setting those regulations, because the government itself is actually made up of people, and if these people are not informed on the technicalities behind the entire thing, they would be handicapped in setting the rules. So I would say engagement and participation is key. Thank you, Carlos.
100%, Michael. I think what I heard coming very strongly is user-centered design. We cannot be pushing things from top to bottom without really testing with the actual users, because again, we're trying to solve a problem that they encounter every day. So understanding that firsthand and then designing should be the way to do it. So from a grassroots perspective, and then getting all the techies that you mentioned to really understand that, because then you bump into questions like, why is people not using it? Adoption rates and things of that nature. Why is it not working? Why is it not scaling? Well, because you really didn't test it with the people that are going to use it. So very good point, Joshua. There. Thank you. I mean, sorry, Michael, for that specific comment. Yeah. Now we do move with you, and thanks for your patience. We are in an era where data flows everywhere, right? We exchange data, and if you go to a specific place and you want to have free access to internet, you're really opening all of your data to be accessible, and you provide that, very freely. Um, Within the work that you do, how do you see data privacy, being of global concern at the moment? I think this has been rules and frameworks put in place to protect users, but I feel like, it's kind of loosely used. And again, at a point, if you have the need of accessing internet, they almost tell you, okay, yeah, you can access internet for free, but give me all of your data in return. And we freely accept that, right? So, how should African healthcare innovators approach, patient data security and compliance with data protection regulations? If you can maybe talk a little bit about that, yeah, that would be great.
Sure, Carlos, and thank you for having me on the panel. It's an honor. And to your question, if you look everywhere across Africa, you will see amazing new healthcare innovations and platforms, and that's really exciting. But how do you ensure that the patient's private, sensitive data is protected? So the question is really, how to innovate and still stay ethical and responsible, right? And we can't ignore what's happening globally. For example, in the European Union, you have GDPR, which sets really high standards for privacy protection that ripples across the world. But the question is, does GDPR really fit in the African context? And so can there be data protection laws that are more tailored for the African context, right? So take South Africa, for example. They have the Protection of Patient Information Act, which is quite similar to GDPR, sharing, the core principles like informed patient consent and data minimization, but it's specifically designed for South Africa. And then you see that happening across other nations in Africa. So you have some, patchworks of privacy laws across the continent like that. And so, but there's an opportunity to innovate for innovators like ourselves. Imagine a mobile health app using blockchain technology to securely store patient data, or maybe a telehealth platform in rural areas using a really innovative way to really get patient informed consent using visual aids, especially for populations that are not too tech savvy. See, so but everywhere every day there seems to be an incident of data breach, which is quite concerning. So you have to build strong cybersecurity. Some of the basic mechanisms that can be applied is, for example, data anonymization, which is about stripping away personally identifiable information, or pseudo-anonymization, which is replacing it with a unique identifier so that it can be traced back to a person. So in summary, I think for all of us who are passionate about healthcare innovation in Africa, so if we get this right, we're not just talking about protecting patients' privacy. It's also about building trust and empowering populations to take ownership in their own health data, and to drive progress in a way that benefits everyone. So I think that will be the foundation for ethical and sustainable technology progress.
Thank you, Yaya. Spoke like a true leader in the area for sure. And I also heard coming very strongly the fact that we have these frameworks that are European based, and they have that context. We need frameworks that speak to our African needs, to where we are, and operating in that serve that purpose. POPIA in South Africa is a good start, but how can we have something that also serves other countries and respects the uniqueness and the context of these countries when it comes to innovation? Thank you so much, Yaya. That was quite insightful. Raphael, I haven't forgotten about you. You're next. And Raphael, from our perspective, how can African regulators, speaking about all of these frameworks and guardrails, and healthcare organizations to that matter, work together to harmonize compliance standards across, different countries, different borders, given the diverse regulatory environments within the continent? I mean, I've heard in the past people referring to Africa as a country, and even within a specific country in Africa, you have different ways in which people interact, relate, etc. So, could you speak a little bit more about that and how your experience been around that, please?
Okay, thank you, Carlos, for the question. And I think maybe to address this, we first need to maybe understand the foundational structures that establish standards or compliance regulations. These are your laws, your statutes related to health, related to telehealth, and as some of the colleagues mentioned, data protection and other relevant areas within the space. So from these standards, these standards are derived from the laws usually upheld by a governing or a regulatory body, which ensures this compliance. I would give an example. Here in Botswana, we have a lot of health statutes, and we have the digital health strategy, as well as the newly enacted Data Protection Act. However, none of these specifically address or speak to telemedicine or telehealth, and there is no dedicated regulatory body for telehealth, which I believe will be soon developed. And as some of my colleagues have already mentioned, we lack this regulatory body or even some of these laws. And so at MedLivery, we as a telehealth provider, we rely on various international standards, like to name a few, your HIPAA, your ISO Health Informatics Telehealth Planning Guidelines. We have the ISO 27001, which is ISMS, and ITU Global Standards for Accessibility of Telehealth Services. I think it was developed by the WHO. And we also incorporate some of the best practices that we see out there. And from these standards or statutes, we consider ourselves or to be compliant, because like I didn't mention, there is no standards or regulations speaking to telehealth. So as you are well aware, the compliance basin encompasses your statutes, standards, and regulations and governance. And therefore, I think now to answer your question, I think African regulators and healthcare organizations should aim to align with existing standards, whether be national or international, So this means hitting the baseline of every internal and external controls within these standards. By meeting the genetic baseline of each standards control, we can develop some kind of a document or working framework that can be tailored for Africa and that can be used by each African state. I believe this approach would ensure compliance standards adopted by different African nations are harmonized and they are not far apart from each other. So maybe the last bit will also to have or to establish an African health or telehealth committee or working group whereby we have regular meetings, conferences, and webinars. That this would ensure that we keep up with the rapid growing technologies and that those policies, those compliance standards are updated and they are reviewed frequently. Thank you.
100%, Rafael. I think two main takeaways from your point is innovations evolve, technology evolves. So how do we make sure that we keep track and we keep compliance to that? And the other piece is do not reinvent the wheel. There's already standards that even though they've been developed elsewhere, we can adapt and make sure that fit the context of our African, context and needs, but don't reinvent the wheel. There's already some things there that can help us to have a baseline to start from and there make it more contextualized to the needs that we have in the continent. Thank you so much, Rafael. As we hit this first set of questions, I would like to remind the panel, the attendees, that you can ask questions. There is a questions button to your right-hand side where you can drop specific questions. I'm monitoring that, and I can pull from there any questions that you may have to the panel. So please feel free to make this a little bit more interactive and ask any questions that you may have. I'll try to run through this next set of questions quite quickly so that we have time to take some of those questions. So I'm just going to go back to you, Dr. Cisse, and if you can give me a quick, solid answer, if you may. The question is around how can African countries leverage this regulatory technology? We are all convened here by RegTech, and I think they also serve that specific purpose to a certain extent. But in terms of to streamline and have this kind of like more direct way of compliance in the way that we process things, but also what challenges we might face in terms of adopting these tools going forward. If you have any thoughts there, Dr. Cisse.
Yeah, as a health professional and an innovator, we face such challenges in different countries, especially the regulation standards different from country to country, and even we don't have any well-noted and well-notified regulatory standards in different countries. But even I suggested to different private sectors and non-governmental organizations, even the public sectors, to legislate such uniform and well-blended regulatory standards as a continental level that will be facilitated by African Union. So if you do have such well-notified and well-blended regulatory guideline for health innovators, that will be very important for adopting in different countries, so that the implementation will be very easy. Even the monitoring and evaluation of data privacy and security should be solved easily. So I suggested even we do have also a digital transformation strategy for plan for African Union. So even we can create a working group, as I mentioned, mentioned earlier. We can create a working group in collaboration with African Union, and we can prepare such uniform regulatory standards that will be very important for health professionals, or even for public sectors. Because the primary challenge as a continent, it is a primary challenge. We faced a challenge related to the regulation. If you go to another country from Ethiopia, there is no similar regulation guideline, so that's the challenge. So we can solve by such mechanisms.
Perfect. Thank you, Dr. Sisay. Just to bring it a little bit more of that interactive aspect, I'll stop here just from a question of somebody that decided to remain anonymous. And maybe any of you in the panel, feel free to respond. The question is, I would like to know the landscape of digital training innovation for healthcare professionals workforce in Africa. So, anything related to the health works training in terms of framework. Does any of you in the panel would like to take that, know a little bit about that? Feel free. Otherwise, we can go around. Dr. Sisay, anyone? Yaya, want to take a stab at it? Oh, good. Well, I'll let you think about it. We'll go to the follow-up questions. Maybe Yaya will carry on with you.
I could try a
How are
bit.
global health regulations, such as the ones from WHO and the source, influencing compliance standards in Africa? And how can Africa regulators customize these same frameworks to suit local context? I think we touched a little bit about it before, but do you have any sense and any notes you want to share with us?
Carlos, can you hear me?
Yes, Michael?
Okay, is it possible for me to attend to the first question? I think I might have a thing up too.
Michael, I think let's just go with Yaya for that question, and then we come back to the question if that's okay with you. We have another one coming. Yaya,
Cool.
please go ahead.
Okay, Carlos, thank you. So the question is, how do you take these global goals, right, and make them work in places with completely different healthcare systems, resources and history? So that's a real challenge. But compliance standards, what does that really mean? So these are really benchmarks that countries have to meet to make sure that their health practices are in alignment with global standards, right? It's like a quality control checklist. But here's the catch. You've got 54 different countries across Africa, and trying to apply a one-size-fits-all really falls short, right? So then the idea of adaptation comes in. So it's not about lowering standards, but it's to say, okay, so how do we achieve the same goals in a way that is relevant and feasible in each of these countries? And so it's like not throwing the baby out with the bathwater, right? It's just trying to figure out how to make the bathwater work for you. So a great example, for example, could be blending, traditional medicine with conventional healthcare systems. Getting community health workers involved in the healthcare system as well. And so this idea of adaptation of these global, compliance standards to each individual country, but also avoid fragmentation. So as I said, we have 54 different countries. And so what that means is that we have a highly fragmented regulatory environment. So we need to make it in a way that, these compliance are, cohesive and consistent as much as possible across the continent. So I think for us, it's more about adapting, compliance standards in Africa to existing global frameworks, and also leading development of new ones, right? So I think it's important to make sure that there's collaboration, that Africa is also at the table of defining these global standards. So it's go beyond the idea of one size fits all and apply adaptation and collaboration with local expertise.
Perfect. Yeah. Thank you so much for that. And shame, we just lost Michael, who had an answer to the first question. But just to mix it up, we have now another couple of questions. The second one that we have from Demilade is, with the increasing adoption of telemedicine across Africa, how can we ensure platforms address infrastructure challenges such as internet accessibility and in underserved regions. Does any of you would like to take a stab at that? Michael, welcome back. We go back to you if anyone has an answer for this question that I just mentioned. Want to take a stab at it?
I think with regards to the, I'll let Michael take a stab at the first question, but I'd also like to say, you know, ChatGPT is a very good system. 1 minute search on ChatGPT gave me Afia Learn, ADHS, different platforms, digital network conferences, Premier Medical Systems. So you can check out more, but I'm sure Michael can give us something more structured to think about it. With regards to the to telemedicine provision in underserved areas, I think that is the heart of what we're talking about today: inclusivity in design and visioning and guidelines for what we're doing. I think this is a top-down and bottom-up kind of approach, public-private sector, all hands on deck, because it's a question of access. We want to make sure that the infrastructure is built out. I know in Nigeria, 1% of all the money that is raised by the telehealth, by the networks, goes into a foundation where they use that money to pay for telco infrastructure in rural areas. So such types of interventions are important across Africa and has driven, you know, penetration in the rural areas. Other things that entrepreneurs should take into account is the blending of high fidelity, low fidelity approaches in their. You can look at use of mobile phone, what's it called, text messaging systems connected to your high-speed internet infrastructure. So you don't necessarily need to be all 5G across your systems all the time. You could look at you know, simpler technologies that transmit little packets of information and not necessarily you know, huge volumes of data and things like that. Those are some of the thoughts I would apply to that question.
Thank you. Thank you so much, Dr. Chibu. So now, Michael, we go back to you on the first question, and then we'll move to the third one. Please, go ahead.
All right. Thank you very much. So about the first question, right, I would just like to speak to it from this perspective, and that is the perspective of the entire digital thing, technology and all being an enabler, right? I'm pretty sure most of us see it that way. So what this means is any industry, any sector trying to, you know, infuse digital innovation literally is just trying to use technology to enable whatever they have going on. And speaking in specific terms, talking about the healthcare professional workforce in Africa, I'm not sure if there is that body, as it were, dedicated to just training healthcare, you know, professionals. However, it is important to know that whatever knowledge you kind of get as it pertains to digital technology is transferable, right? So this is the time where you will see a data scientist consulting for a fintech at the same time consulting for a health tech. Why? Because it's an enabler as it is, right? So I'm saying this to say, or to answer that very person, that your interest might just be because, I mean, I faced this conundrum when I was about to do like pivot from the health space, you know, leaving the practical or rather the clinical sector into software engineering. I was like, okay, let me maybe check some boot camps or startup or schools rather, you know, health, or let me say tech schools that focuses on, you know, health professionals, but I couldn't find any, right? And as I went deep into the training and eventually became who I am, right, I see the reason why there shouldn't be any as it is, right? So what is there is for the person to know their niche in the healthcare space as a professional, then acquire whatever skill you want to acquire. There are various skills available for a healthcare professional who want to be tech savvy. You could decide to be a data scientist, right? You could decide to be a software engineer. You could decide to be a product, you know, product designer, and there are plenty.
Oh, no, we lost Michael there for a little bit, but I think we got the gist of it. I think there's another question from Grace. Michael, you're back there, but I think we got the gist. Do you have any final thoughts? I think we can move to the next one if that's okay with you.
Yeah, that's fine. We can move to the next one.
Thank you so much. Grace Kayora has another question, which is very related. Healthcare workers might not be adequately trained to use digital tools, and patients may lack familiarity with technologies, such as mobile applications or telemedicine platforms, limiting the effectiveness of digital health intervention. She's wondering if there's any working committee to facilitate this type of training. I think, Michael, you touched on it, but anyone else on the panel want to comment from Grace's question? Otherwise, we can go to the following one. This is from Anonymous. Using the one of the population inclined country in Africa is a fact that people are not conversant with telemedicine or its benefits. What ways can we engage in a deep change behavior campaign, especially in making Africans have access to basic healthcare via telemedicine? So I think if I can reframe, how can we make this telemedicine offering available, to everyone, and for them to know that this is an option that they can access? Obviously, we spoke about the challenges when it comes to connectivity, access to phones, computers, internet, and the sort. But any of you have an idea on how we can make this awareness sort of demand generation campaign to make that available? Dr. Chibuso.
Can I chip in on this?
Oh, go ahead.
Yes, Rafael, you can. Yeah. Sorry, Rafael, you want to go and take a first pass at it? Thank you.
My 2 cents is that, I think sometimes as founders or innovators, when we are developing products, we sort of have our assumptions, right? And we later find out that no, we must change our strategy. I'll give you an example. Here in Botswana, we have Medlivery, very functional and working, but you can have a good product and nobody will use it because they don't understand what telehealth is or what telemedicine is. So one of our next strategies going into the next year is to make sure that we have this awareness campaigns. We make sure that we have webinars. We collaborate with good people like, our panelists here. We also, so that the people can have a good idea of what telehealth is. Even at the rural or unserved and underserved areas, there are NGOs there where they take care of, for example, the elderly, the orphaned kids, so that even when these kids, they grow up, they can have this knowledge of what telehealth or telemedicine is. Thank you.
100%. Let's move on, and maybe Dr. Chibuso, there's another opportunity for you to chime in. Here is another one. There's a lot of amazing work being done out there. What do you see as the most commonly necessary health tech innovation for Africa at the moment? I think that's a very broad. I think we can all say there's a lot there, but any idea, without being biased, on your own innovation?
I think that, like you said, it's a very broad space, and it's honestly, there's a lot that is helpful and useful. I wouldn't take it from the one that is most necessary. I would look at it from what is it that is patient needed? What is it that is going to move the needle? I think things that improve access, these are most needed. Things that scale, things that are simple, those are the things that you want to put at the forefront and support. And at the end of the day, we do need, these massive collaborative projects that have work streams and all of that, because it moves the entire ecosystem forward. But in my experience in the last 20 years, those things just, end up not being the flagship of the things. It's usually the simple things that patients adopt and they just go like wildfire. So yeah, I think I like to let innovators and consumers pick winners rather than governments and panels.
Thank you, Dr. Chibusa. Anyone else want to chime in there? Otherwise, we can go to the next one. From Blessing, what are the biggest challenges in collecting high quality and well-encompassing health data in Africa? And how can technology help overcome these challenges, especially data that can be used to train models? I think we're speaking about AI, machine learning of some sorts. Dr. Sise, Yaya.
I can take a stab at it.
Yes, Yaya.
Yeah. So as you mentioned, I think it's definitely related to AI and how to use data, Africa-based data, to train models. I think we have to be realistic to know that these models require lots of data, and and also training the models requires an enormous amount of electricity or power, so which isn't always available in Africa. But there's an opportunity to leverage existing models from other parts of the world and fine-tune them, augment them, enrich them with local data. And I think the question here is, how do you collect that data? How do you capture quality data to be able to do those things, right? So there also AI can be used because you have many challenges digitizing healthcare data, with existing technologies. But AI today actually has the capacity to, extract data from voice communications, from paper-based systems, and translate that, or maybe encode that into data that can be used to train these existing models. So I think these are some of the things that can be done to really build a customized and proprietary set of data for models in Africa. So that's what I can say about this.
Definitely. Thank you so much. Guys, we're reaching the end of this incredible panel. Sorry, I really wanted to take some points from the audience. I think just in closing, Adrian is saying, from an internet connectivity perspective, we have seen fantastic progress with the deployment of Starlink satellites to remote locations. This is making big difference to help connect the rural community. And there's also competition coming, which will reduce the pricing over time. So bridging the gap of connectivity and making it more available, that's what we want to see as well. Let's just do one last one from Lone. She's saying, with the inclusion of AI into healthcare management databases, the Black African population is highly underrepresented. What approaches would you put in place to enhance digital info for clinical trials participation? I think this is the question. And Yaya, you touch on it. I think these models have been trained with, the global north type of data. They're highly biased when it comes to our own context and needs. So what can we do to sort of also move the needle when it comes to data coming from Africa that can inform these models and can benefit us, even further? I don't know if any of you has a strong opinion on this, but I think it's a great question. Gone once, gone twice.
I'll just jump in. Yes, I think as innovators, we owe it to the African race. You just jump in and contribute to that data pool. Last year I attended the CES event, and I was shocked. There was this app where they would screen your face and tell you issues with your skin. And I screamed, and it just couldn't recognize me. And there are stories everywhere of like doors not being able to recognize Black people, and those crazy stories, and they exist. And that is the truth. I think we owe it to ourselves to not only just contribute to the conversation, but contribute to the data pool, and not contribute in I want to get on the table by any means, but contribute in a meaningful way. We need to amplify our voice. We're 1/8 of the human race, and we can't let just 7/8 of the race determine what happens to the entire population. We just need to get in there. We need to be on the table. We need to be contributing on the table, and we need to be also part of the we shouldn't just be the product. We should also contribute to being developers and controllers of our own destiny and stories. You just have to play. That's it.
Excellent. Dr. Chibuso, I think that is a good closing statement for this panel session. The main takeaway, let's get involved, let's participate, let's make sure that our voices are also raised and heard in whichever way or form, and let's look and contribute as a community to also generate that platforms in which we can all participate, contribute, and sort of learn together, but also make sure that this works for us. I thank you all for being here in this panel. Faidat, I'll hand over to you, but it's been a great pleasure to hear from you. And thank you so much for your time and all the questions coming through.
Thank you so much to all of our panelists for that engaging and thought-provoking session. Thank you, Carlos. You were a great moderator. It's been absolutely amazing to learn about all the ways to expand access to care and improve, patient outcomes. It's been incredibly inspiring. And to our audience, thank you for your active participation. It was amazing seeing all of the Q&A in the session. Please keep the momentum going as we move into the next session. We have a product showcase coming up to demonstrate how AfriHealth is building a solution to harness technology to transform patient outcomes. And then after that, we have our final session for today, which would be a roundtable on a very important topic, health data governance and policy and privacy. Sorry. Thank you so much, everyone. Thank you again to our panelists. So
thanks, everyone.
Moving to the session. To join the session, go to the agenda at the top of the conference platform. Simply click the join button on the right of the next session's topic, and you're in. Thank you.